Imagine Dr. Alam. He rises before dawn in Addis Ababa. His days are a relentless battle in an under-resourced hospital. His meager salary barely covers basic needs amidst spiraling inflation. Yet, Dr. Alem reports for duty. He confronts a tide of suffering, often with limited supplies. A single doctor might be responsible for over 13,000 individuals. He witnesses preventable deaths due to missing drugs or broken machines, a heavy emotional burden. Yet he and other healthcare workers continue to fight with expertise and compassion. Now they are standing up, demanding change for the nation's healthcare. Dr. Alam's plight reflects a nationwide crisis, multiplied across Ethiopia. The healthcare system is gasping for air, starved by underfunding. The nationwide strike is a painful symptom of this deep-seated malaise, an anguished appeal. Doctors and nurses signal that the system is collapsing, threatening millions. This is a desperate fight for the nation's future. The narrative of Decay is tragically consistent. For Ethiopians facing poverty and disease, healthcare access becomes another battle. Treatable illnesses become death sentences. The human cost is a silent epidemic of suffering. This moment is a dangerous intersection for Ethiopia. It's about the value a nation places on its citizens' health. The government's response will be a defining chapter. Will it deepen the already dangerous chasm? The crisis in Ethiopia's healthcare system is rooted in economic despair. Doctors often earn as little as $80 to $200 per month. This meager sum is a direct threat to their survival. In a nation that desperately needs their skills, these healers are struggling to stay afloat. Compounding this is hyperinflation and severe currency devaluation. The price of essential goods climbs relentlessly, while their earnings remain stagnant. The dream of a stable life becomes an agonizing daily challenge. Nurses and technicians often earn even less, plunging them deeper into financial distress. Many are forced to leave the profession or seek opportunities abroad, contributing to a devastating brain drain. The fight for a living wage is a fight for the very sustainability of the healthcare system itself. The struggles of Ethiopia's healthcare workers are mirrored in their workplaces. Hospitals are chronically ill, starved by underfunding. This translates into a dire shortage of basic medical supplies. Imagine a surgeon without sterile gloves, or a nurse without medication. Clean water can be scarce, and oxygen dangerously low. Overcrowding is a grim constant, painting a picture of systemic failure. The human cost is amplified by one of the most challenging doctor-to-patient ratios in Africa. The impact is a profound erosion of patient safety. There is a deep moral injury inflicted upon healthcare professionals. This engenders a pervasive sense of helplessness and frustration. Ethiopia's healthcare system, already strained, is further crippled by internal conflicts. Violent clashes have created casualties and dismantled fragile healthcare infrastructure. War introduces violence targeting institutions designed to heal. Healthcare workers face dangers daily as medical facilities are attacked. Ambulances are attacked and medical professionals are killed, like Dr. Andualem Dagna. In Tigray, over 70% of hospitals were damaged. The principle of medical neutrality is disregarded, leaving populations exposed with no recourse to care. The scars of war on Ethiopia's healthcare are deep and will take generations to heal. The dire state of Ethiopia's healthcare system is rooted in a history of systemic neglect by successive governments. Chronic underinvestment and lack of prioritization has been a persistent ailment. Warnings about crumbling infrastructure and insufficient supplies have largely gone unheeded, creating a fertile ground for the current crisis. Broken promises from authorities, especially during health emergencies, have eroded trust. Criticism is voiced regarding the allocation of Ethiopia's national resources, skewed away from essential public services. This contrasts with the starved healthcare budget, fueling public anger and resentment among healthcare professionals. The decision to strike is a manifestation of deep-seated despair and a cry for fundamental change. Years of silent suffering reached a tipping point. Ethiopia's medical professionals decided to strike. It was a collective cry, forged in preventable loss and personal hardship. The nation held its breath as the date approached. Monday, May 13, 2025, became a date etched in Ethiopia's history. Thousands of healthcare workers initiated their nationwide strike. The action commenced as a partial stoppage, a calculated measure to signal their grievances. The effects were felt in major urban centers. Hospitals like Tikura and Besa Specialized Hospital saw non-emergency services halt. Outpatient departments transformed into quiet ghost towns. Elective surgeries were postponed, appointments canceled. The strike was an agonizing period for medical professionals. They viewed the strike as a moral imperative to prevent the collapse of a failing healthcare structure. At the heart of the strike, Ethiopian doctors demanded fair compensation. Their salaries, as low as $80, $200 a month, were inadequate due to hyperinflation. They also sought improved working conditions, an end to medical supply shortages, and the repair of outdated equipment. The healthcare workers demanded an end to government repression and called for genuine dialogue, accountability, and respect for their expertise. This strike was a statement about the value of human health and the rights of Ethiopian doctors and nurses to work in conditions upholding their ethical commitments, aspiring to a system that serves all Ethiopians. As the first fraught week of the nationwide strike drew towards its close, by Monday, May 19, 2025, alarming reports started to emerge indicating a serious escalation in the strike's scope and intensity. For instance, at the Tibebe Gion Specialized Hospital in Bahir Dar, a staggering 95% of all health workers joined in a full work stoppage. This decisive shift from partial to comprehensive strike action powerfully demonstrated the deepening resolve of the professionals and underscored the failure of any initial government response. The consequent impact on patient care inevitably grew far more severe. While critical units such as emergency rooms, busy maternity wards, the escalating strike began to place immense pressure even on these essential services. The reduction in staff meant dangerously longer waiting times, compromised quality of care, and increased risk of adverse outcomes. The line between a targeted protest and a healthcare catastrophe was becoming blurred. Across Ethiopia, the devastating human cost became increasingly visible. Distraught families arrived at hospitals after long journeys with critically sick children or severely injured relatives, only to be met with drastically reduced services or, in tragic cases, complete inability to provide care. Painful stories began to circulate widely, tales of patients deteriorating due to missed treatments, of vital medical procedures being indefinitely delayed. The anxiety among the populace grew palpable with each passing day. The strike served as a brutal diagnostic tool, laying bare the extreme fragility of Ethiopia's healthcare system. The disruption was not merely a consequence of the doctors' actions, but a symptom of decades of underfunding, systemic neglect, and impossible pressures on the workforce. The sight of paralyzed services underscored how dependent the nation was on these professionals. Ethiopia was confronting a stark choice: address the deep-rooted causes of this crisis, or witness a complete collapse of public health. The Ethiopian government reacted swiftly and severely to the doctors' strike, declaring it illegal. Security forces began arresting striking health workers, specifically targeting prominent figures like Dr. Yonatan Dagnu. Reports emerged of heavy-handed tactics, including security forces entering hospitals and allegedly assaulting patients and doctors. Striking professionals spoke of pressure and threats to their jobs and licenses, creating an atmosphere of fear. However, for some, this repression hardened their resolve, underscoring the need for systemic change. The government's response to the doctors' strike was not just physical repression, but also dismissive rhetoric from the highest levels. Prime Minister Abiy Ahmed publicly downplayed the doctors' demands, stating, "The government will not solve poverty by distributing individual salaries." This statement was seen as a profound misunderstanding of the doctors' plea for basic living wages in a time of hyperinflation. The contrast was stark. While doctors struggled, the government spent billions on a new presidential palace and military projects. For many, this exposed a troubling disconnect between government priorities and the needs of its people. The Ministry of Health, led by Dr. Mekdis Daba, claimed to be in talks with professional associations, but health workers described these as superficial and unproductive. No concrete proposals emerged, just public assurances and empty promises. The trust deficit widened as officials began blaming striking professionals, accusing them of being misled or acting maliciously. These accusations insulted thousands of dedicated medical workers who had endured years of hardship. Instead of fostering dialogue, the government's language deepened resentment and mistrust. The administration's approach only fueled further alienation among health professionals. The government's credibility eroded with every unfulfilled promise. The crisis was no longer just about salaries. It was about respect, survival, and the future of public health. The government's heavy-handed tactics backfired, sparking public outrage and solidarity. Ordinary Ethiopians directly affected by the healthcare crisis increasingly sided with the striking doctors and nurses. Stories of families unable to access care spread rapidly, highlighting the human cost of the crisis. The public saw the doctors not as agitators, but as courageous advocates for everyone's right to health. Teachers, university staff, and other public servants began voicing support. The government's narrative lost credibility. Public empathy became a powerful force. The doctors' fight was now seen as a fight for the nation's well-being. Solidarity grew, bridging divides and uniting diverse groups against a common threat. The movement gained momentum, fueled by a shared demand for dignity and justice. The world took notice as Ethiopia's crisis deepened. Amnesty International condemned the government's crackdown, demanding the release of detained health workers and calling for genuine negotiations. They highlighted past violations, including attacks on medical facilities and the killing of Dr. Andualem Dagna, underscoring the dangers faced by healthcare workers. Human Rights Watch and Médecins Sans Frontières, documenting attacks and demanding accountability for violence against medical staff. Even Ethiopia's own Human Rights Commission urged the government to respect human rights international and domestic voices, united in condemning the government's actions. The crisis was now a global concern with mounting pressure for reform and justice. The government's reputation suffered as evidence of abuses mounted. The call for accountability grew louder, demanding protection for those who heal. The world watched, waiting for Ethiopia to choose dialogue over repression. The message was clear: healthcare is a human right, not a bargaining chip. Reform or further isolation. The international community stood ready to support a just resolution. That Ethiopia's healthcare crisis threatened catastrophic consequences. The strike and government repression risked collapsing an already fragile system, endangering millions. Maternal mortality, infectious disease outbreaks, and malnutrition would all worsen without urgent action. International aid partners grew wary, considering cuts if abuses continued. This pressure became a key leverage point for change. Calls for independent investigations into human rights abuses intensified, with a focus on protecting healthcare workers. The demand was not just for documentation but for real justice and prevention. The crisis exposed the urgent need for accountability and respect for medical neutrality. The world's response would shape Ethiopia's future, either towards recovery or deeper crisis. The stakes were clear: protect health workers or risk a humanitarian disaster. The time for action was now. International bodies like the African Union and United Nations were urged to mediate the crisis. Their involvement could foster neutral negotiations between the government and health professionals. Global health organizations offered technical assistance training and vital supplies to rebuild Ethiopia's healthcare system. Aid could be conditioned on measurable improvements, protecting workers, increasing budgets, and ensuring supplies. Strategic incentives and potential sanctions created pressure for real reform. Sustained advocacy and global awareness were essential. Supporting human rights groups kept the crisis in the spotlight. The world's attention was a powerful tool for change. International solidarity could help drive lasting solutions. The path forward required both pressure and partnership. The crisis demands more than observation. It calls for action. Amplify the voices of Ethiopian health professionals by sharing their stories and verified reports. And Human Rights Watch through donations or volunteering. These groups document abuses and advocate for justice, pressuring the government to respect rights and release detainees. Humanitarian aid is urgently needed. Support Doctors Without Borders and similar organizations providing care on the ground. Your contributions can deliver life-saving medicines and supplies to those most in need. Support specialized initiatives and diaspora-led projects building long-term healthcare capacity. Groups like Facing Africa and the Ethio-American Doctors Group are making a difference. Every action, no matter how small, helps sustain hope and drive change. The world's solidarity is a lifeline for Ethiopia's future. Together we can help restore dignity, health, and justice. Supporting Ethiopian professionals is crucial for impactful change, offering both immediate relief and long-term benefits. We can contribute to international scholarships, specialized training programs, and professional exchange opportunities for Ethiopian doctors and nurses. These programs enhance skills and provide respite from daily pressures. International pressure for policy changes remains paramount. We must urge governments and organizations to prioritize healthcare worker protection and infrastructure. Empower local communities and grassroots organizations. Consider funding community-based programs like Ethiopia's Health Extension Program. Lasting solutions require commitment from the Ethiopian government. Authorities must engage in negotiations with health associations, releasing detained professionals. Ethiopia's doctors and healthcare professionals face a profound crisis, born from years of systemic neglect, economic hardship, and internal conflicts. A nationwide strike, a symbol of their desperation, has paralyzed healthcare services, endangering countless patients. Ethiopia's doctors and healthcare professionals face a profound crisis, born from years of systemic neglect, economic hardship, and internal conflicts. Ethiopia stands at a critical juncture. The government's response has worsened the situation, resorting to crackdowns and arrests, drawing condemnation from global organizations like Amnesty International and the WHO. International partners must offer unwavering support. This moment calls for international solidarity. There is still hope through collective action and a commitment to human dignity. The future of Ethiopia's health hangs in the balance, demanding swift, decisive action to avert a devastating collapse. Let us choose the path of healing and enduring hope.